Cardiovascular disease strikes in every nation around the world. From sudden cardiac arrest to the disabling effects of ACS and stroke, cardiovascular disease remains a leading cause of death and disability in many parts of the world. Understanding and activating the systems of care developed by the American Heart Association can help improve survival rates and may even prevent cardiac arrest. You play a pivotal role in providing high-quality cardiovascular care. What you do matters. What you learn can save lives. In this science overview video, you'll be presented with the most recent recommendations on cardiovascular care based on the latest scientific studies. In the next few minutes, we'll outline the changes in the 2010 American Heart Association guidelines for emergency cardiovascular care and continue to emphasize some of the core recommendations from the 2005 guidelines. These guidelines were produced after an exhaustive review of thousands of peer-reviewed publications. We'll approach these changes systematically by first reviewing changes to basic life support, or BLS guidelines. The steps in the BLS survey for healthcare providers have changed. Instead of the familiar steps of A, B, C, D, where clearing the airway and breathing come before chest compressions now take priority for the unresponsive arrest patient. The guidelines now recommend delivering chest compressions first, before clearing the airway and giving ventilations. The American Heart Association removed look, listen, and feel for breathing and giving 2 rescue breaths from the initial assessment entirely. So the BLS survey now includes these 4 steps. Step 1. Check for responsiveness. Tap and shout, "Are you all right?" and scan the chest for movement. Step 2. Activate the emergency response system and get an AED. Step 3. Circulation. Check the carotid pulse. If you find a pulse, support the patient with rescue breathing once every 5 to 6 seconds. If you cannot feel a pulse within 10 seconds, initiate CPR by giving 30 chest compressions followed by 2 ventilations. Do not spend more than 10 seconds checking for a pulse. Step 4. Defibrillation. As soon as possible, connect an AED or defibrillator and, if indicated, deliver a shock. Why was it necessary to change these familiar steps? The majority of adult sudden cardiac arrest patients have VF or pulseless VT rhythm. The heart is quivering but not effectively pumping blood to vital organs. These patients have a much higher survival rate if they receive immediate chest compressions and early defibrillations. The ABCD sequence often delayed chest compressions. By changing the sequence and giving chest compressions first, more patients may achieve return of spontaneous circulation, or ROSC. However, there are cases where healthcare providers should tailor the sequence of rescue actions to fit the most likely cause of arrest. For example, in the case of a drowning victim or other instances where hypoxia is the likely cause of the cardiac arrest, the priority would be to provide rescue breathing. High-quality chest compressions were emphasized in the 2005 guidelines. The American Heart Association continues to place a strong emphasis on high-quality CPR. This is indicated by a rate of at least 100 chest compressions per minute, a compression depth of at least 2 inches in adults, allowing complete chest recoil after each compression, switching rescuers every 2 minutes, minimizing interruptions in compressions, and avoiding hyperventilation. The recommendations continue in the new guidelines because scientific studies continue to link high-quality CPR to ROSC. High-quality chest compressions maintain blood flow to vital organs, especially the heart and brain. One way to measure the effectiveness of chest compressions is with coronary perfusion pressure. Coronary perfusion pressure is the difference between the pressure in the aorta at the end of ventricular relaxation, or the aortic end diastolic pressure, and the pressure in the right atrium, or the right atrial end diastolic pressure at the same time. The higher the coronary perfusion pressure during CPR, the better the survival rate for the patients. As chest compressions begin, it takes several compressions to raise the coronary perfusion pressure to a level adequate to supply blood to the brain and heart. When rescuers interrupt chest compressions, perfusion pressure falls dramatically and remains very low until they resume compressions. Since coronary perfusion pressure measurements are not readily available during a resuscitation attempt, rescuers can monitor CPR quality with waveform capnography and intra-arterial relaxation pressure. In the 5 decades since chest compressions were first attempted on a cardiac arrest patient, there have been significant improvements in the treatment of acute cardiovascular disease. There is much more work to be done. With the latest research pointing to new quantifiable ways to improve patient outcomes, advanced providers have more tools than ever before to reduce death and disability caused by cardiovascular diseases and stroke.
The American Heart Association is the nation's leader in life-saving CPR training. In fact, we write the CPR guidelines for everyone, the public, doctors, nurses, and paramedics. This year, we've made a few changes so that it's much easier for anyone to save a life using CPR. Let's take a quick review of the new CPR process and when to use it. When someone's heart stops beating, it's called cardiac arrest. CPR is needed right away when this happens. Cardiac arrest victims will die if they don't get help fast. When cardiac arrest strikes, the victim typically collapses, stops breathing, or stops breathing normally and can't respond.
Sir.
If the victim does not respond, and the victim is not breathing or not breathing normally, yell for someone to call 911 and have them get an AED. An AED is a portable electronic device that helps the heart return to its normal rhythm. If you're alone, call 911 and get the AED yourself. Then follow the AED's voice prompts. If no AED is available, immediately start CPR, beginning with compressions. Doing CPR is not hard. Anyone can do it. And now the American Heart Association is making CPR easier than ever. We used to tell people that the proper steps for CPR are airway, breathing, compressions, or ABC. But we've changed that order, so the compressions come first. It's now compressions, airway, breathing, or CAB. This new order makes it easier because anybody can start out with compressions, even with no CPR training. Just push hard and fast on the center of the chest. If you haven't been trained, keep pushing until help arrives. When you give compressions, make sure you push the chest down at least 2 inches and allow a little time for the chest to come back up. Push as hard and fast as you can. The perfect rate for compressions is at least 100 per minute. That's the same speed as the beat of the song Stayin' Alive, so try to keep that tune in your head if it helps. If you've been trained in CPR, push on the chest 30 times, then open the airway by tilting the head back and lifting the chin. This helps air reach the lungs. Next, give 2 mouth-to-mouth breaths over 1 second for each breath, and watch for the chest to rise. Continue the CAB cycle until help or an AED arrives. Use the same CAB cycle for adults, children, and infants. This is just a quick overview. So to learn more or to sign up for CPR training that can help you save someone's life, visit our website at www.heart.org/CPR.
Heel of one hand on the center of the bare chest, between the nipples. Then put the other hand on top of the second. Make sure the long axis of the heel of your hand is on the breastbone to reduce the chance for rib fracture. Your shoulders should be right over your hands and your elbows should be straight. Either extend or interlace your fingers to keep them off the victim's chest. You're going to push straight down on the victim's chest, ensuring that you're pushing directly on the breastbone. For adults and children that have reached puberty, you'll press down 1.5 to 2 inches. After each compression, let the chest come back to its normal position, ensuring full chest recoil. This allows blood to flow into the chest and heart. Perform 3 sets of 30 compressions at the rate of 100 per minute, counting out loud as you press. Are you ready? Here we go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Okay, now you know the basics of mouth-to-mouth breathing. It's a quick, effective way of providing oxygen to a victim. However, as mentioned previously, you and Sally are healthcare professionals. As such, you're required to use standard precautions whenever there is exposure to blood or other bodily fluids, like saliva. These precautions include using barrier devices, such as a face mask. A face mask usually has a one-way valve and diverts exhaled air away from the rescuer. There are different sizes for adults, children, and infants, so make sure you're using the appropriate size for a victim. The mask should only cover the victim's mouth and nose. It should not extend over the victim's eyes. Okay, here's your chance to try mouth-to-mask breathing. You should already be in position to practice. Once again, practice along with the video and make sure you see the chest actually rise with each breath you give. We'll practice 5 sets of 2 breaths together. You ready? Here we go. Kneeling next to the victim, place the mask on the victim's face, using the bridge of the nose as a guide for correct position. Seal the mask by placing the index finger and thumb of your hand closest to the top of the victim's head along the border of the mask. Place the thumb of your other hand along the lower margin of the mask. Open the airway using a head tilt chin lift. Press the mask down and lift the jaw to hold the mask tightly against the face, and give 2 breaths while watching for chest rise. Each breath should be delivered over 1 second. Okay, you know how to do compressions and give breaths. Let's practice them together. We're going to do 3 cycles of 30 compressions combined with 2 breaths, using mouth-to-mask breathing. Remember to press down 1.5 to 2 inches when you compress and allow full chest recoil. You should already be in position, so practice along now as we combine both steps into one sequence. You ready? Here we go.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
Sometimes rescuers will only give breaths without chest compressions. This is called rescue breathing. Ventilation is more effective when providing rescue breathing for an unresponsive, non-breathing victim when you use a bag mask system. A bag mask device consists of a ventilation bag and a face mask. The bag may or may not contain a valve to prevent rebreathing of exhaled air. The bag mask system is the most common method of providing rescue breathing in healthcare settings and during 2 rescuer CPR. It can be used with or without an oxygen source and comes in a variety of sizes. If you're using supplementary oxygen with the bag mask, the delivery method is exactly the same as without supplementary oxygen. Deliver each breath over 1 second, making sure you do not deliver the breath too quickly or forcefully. This will help reduce the chance of gastric inflation, air going into the victim's stomach instead of his or her lungs. If too much air enters the stomach, it can cause vomiting and potentially aspiration. If you're performing 2 rescuer CPR, you can use the EC clamp technique to hold a mask in place. This technique requires instruction and practice. Here's your chance to do it. As before, practice along with the video. Are you ready? Here we go. First, position yourself directly above the victim's head. Place the mask on the victim's face using the bridge of the nose as a guide. Use the thumb and index finger of one hand to make a C to press around the edges of the mask. The remaining fingers of your hand should form an E to lift the angle of the jaw and open the airway. Make sure you squeeze the mask with your thumb and the heel of your hands while lifting the jaw to achieve an airtight seal. Squeeze the bag with your other hand or push it against your leg or body. If the chest doesn't rise, then you are not providing adequate breaths. Adjust the mask, reposition the head and neck, or administer a larger amount of air. With or without supplementary oxygen, give 1 breath every 5 to 6 seconds. Practice this now for 1 minute.
2, 3, 4, 5, 6, 7.
When another
8,
rescuer is
9,
available
10,
to assist
11,
with CPR at the
12,
scene,
13,
the second
14,
rescuer
15,
should activate the
16,
emergency
17,
response
18,
system
19,
if he or
20,
she is not
21,
EMS
22,
and
23,
get
24,
an AED.
25, 26,
Help is on the
27,
way.
28, 29, 30.
In two rescuer CPR, each rescuer has specific roles. The first rescuer performs chest compressions and counts out loud. The second rescuer maintains the open airway and gives breaths. The compression rate for two rescuer CPR is approximately 100 compressions per minute. The compression ventilation ratio is 30:2. Compression should be paused when giving ventilations until an advanced airway is in place. When performing CPR without an AED, rescuers should switch roles every 2 minutes to prevent fatigue. This switch should take less than 5 seconds, minimizing hands-off time. Rescuers also need to assess the rescue effort. The person ventilating the victim must observe the chest compressions that are delivered, encourage the compressing rescuer to push at an adequate rate and depth, and ensure that full chest recoil occurs after each compression. Things change slightly when you perform two rescuer CPR on children who are up to the age of puberty. For these CPR guidelines, puberty is defined as chest or underarm hair on males and breast development on females. In this case, you'll use a ratio of 15 compressions to 2 ventilations. Now let's take a look at a complete sequence of CPR with the initial assessment, followed by cycles of compressions and breaths. Now watch carefully, because you'll get a chance to practice all these steps together soon.
Look.
Sir, are you okay? Sir, can you hear me? Mike, he's not responding.
I'll get help from the ED.
One, two, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3, 4, 5, 6, 7, 8, 9.
Step 1. Check for responsiveness. Tap and shout, "Are you all right?" and scan the chest for movement. Step number 2. Activate the emergency response system and get an AED. Step 3. Circulation. Check the carotid pulse. Do not spend more than 10 seconds checking for a pulse. If you find a pulse, support the patient with rescue breaths. If you can't feel a pulse within 10 seconds, initiate CPR. Immediately give 30 chest compressions, followed by 2 breaths. Okay, step number 4, defibrillation. As soon as possible, connect an AED or defibrillator, and if indicated, deliver a shock. Let's take a look at how the BLS steps come together in an arrest situation with an unconscious patient. Here's our case scenario. A 57-year-old man is experiencing many of the warning signs of acute coronary syndromes, with chest discomfort, indigestion, and feeling faint. He collapses and falls to the floor.
Sir? Sir, can you hear me?
Look or scan the chest for movement.
He's unresponsive. Call a code and get the AED and crash cart now. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. One, 2, 3,
The code team is on the way.
6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20.
Apply
21,
pads to
22,
patient's
23,
bare
24,
chest.
25, 26, 27, 28, 29.
Plug in pads connector.
One,
Analyzing heart
Okay,
rhythm.
stand back.
Stay clear of patient.
7, 8.
Shock advised. Charging. Stay
I'm ready
clear
to
of
shock.
patient.
I'm clear,
Deliver
you're
shock
clear,
now.
we're all clear.
Press the shock button now. Begin with compressions.
1, 2, 3, 4, 5.
CPR is performed slightly different when a victim has an advanced airway, such as an endotracheal tube, combi tube, or laryngeal mask airway in place. 2 rescuers no longer deliver cycles of CPR. Instead, the compressing rescuer should continue chest compressions at a rate of 100 per minute, without pausing for ventilation. However, ventilation changes to 1 breath every 6 to 8 seconds, about 8 to 10 per minute, being careful to avoid hyperventilation. Also, there is no pausing to provide breaths. Compressions continue as breaths are given. The following scene in progress demonstrates the differences when performing CPR on a victim with an advanced airway in place.
9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30.
After 5 cycles of 2 rescuer CPR, rescuers should switch roles.